came in and greeted my mom and told her, I'm Sarah, I'm a student at the University of St. Francis, and I'm just going to go ahead and do a quick assessment on you, make sure everything's going okay. I've washed my hands, so I'm good to go. I'm going to start with some vital signs. So I'm going to take her blood pressure. We don't have any vital sign equipment in here, so I'm just going to pretend, but I take her blood pressure and pulse and respirations, and I'm going to go ahead and take her temperature. And then I'm going to listen to her heart and breath sounds. I'm going to go ahead and lift up your gown a little bit. I'm going to listen to her heart sounds. And then I pick a pulse for a minute. And I'm going to listen to breath sounds. Okay. And are you in any pain right now? She's not. So now I'm going to go ahead and start with the bubble heat, or the bubble H. And what the bubble H is just an assessment to check your breasts, your uterus, your bowel and bladder, and then your lochia, which is the discharge in your pad, and your episiotomy, that is the cut from when you gave birth, and then your Homan sign, which checks for DVTs. So I'm going to start with your breasts. So I'm just going to lift your gown up a little bit. And I'm just going to feel around and make sure that your breasts are soft and that there are no hard spots or anything. And I'm going to check your nipples and make sure that there's no cracking. You just tell me if you feel any pain at all. I'm just going to feel around. Your breasts are soft. I don't feel any lumps or anything. Is there any pain? She says no. And your nipples look good. They're intact. There's no cracking. Is there any pain on them? No? Okay. I'm going to fold that down. And I'm going to go ahead and check your uterus. So what I'm going to do is I'm going to hold the bottom right here, and I'm going to feel the top. And first I'm just going to check the placement. So I'm just going to put my finger under your umbilicus, which is your belly button. And I'm just going to see where the top is, and it's 1 finger breadth away underneath your uterus. So that's good. And I'm going to go ahead and feel the top of your uterus, and it feels firm. Have they taught you how to do a fundal massage? No? Okay. So what you're going to do is you're going to take your hand, and you're going to feel right here. Do you feel the top of your fundus right there? And if that feels squishy like a Nerf ball, it shouldn't. It should feel like a basketball. So what you're going to do is you're just going to massage it, and that will help it firm up, because we want it to contract. That way it keeps you from bleeding. And your uterus feels good and firm right now. And when's the last time you voided? An hour ago. Perfect. And are you having any pain or anything with voiding? No? Okay. Make sure you go to the bathroom every 2 hours, because emptying your bladder will help keep your fundus and your uterus in the right spot. And if you have a full bladder, there's a lot more room now for your bladder to fill up. So if you have a full bladder, it can push your uterus up, and that'll cause you to bleed more. So we need to make sure we're going every 2 hours. Okay. Now I'm going to go ahead and listen to your bowel sounds. I'm going to listen in all 4 quadrants. Your bowel sounds are active. And have you been passing gas okay? Good. Have you had any stools? No? Okay, well, we're just going to keep working on that. As long as you're passing gas, that's a good sign. You're not having any pain or anything? Okay, good. Now I'm going to go ahead and check your lochia. And that is the amount of discharge that's in your pad. And right now it's a bright red, which we call rubra. And I'm going to go ahead and put gloves on real quick. And you went to the bathroom an hour ago, so did you change your pad then? Yes? Okay. So this is the amount of discharge we have over an hour. So it's a light discharge, which is good, and it's a bright rubra. So if you see that your whole pad is full after an hour and it's completely saturated, then that's a sign of hemorrhaging. So make sure you do that fundal massage or call us in here and we'll help you. But that's just a sign. And if you, there's 3 stages of your lochia. Rubra's the first one. And after rubra, you drop down and it gets lighter and lighter and lighter. So right now it's a bright red. The next stage is going to be a darker red, and then it's it's going to go to a nice clear color. And if you go to that clear color and then jump back to the bright red, that means you're doing too much activity, so you need to rest a little bit. Okay, so that looks good. And I'm going to check your episiotomy while I'm here. And I'm going to check for Rita, and that is redness, edema, ecchymosis, discharge, and approximation. And I don't see any redness or anything. Is it still painful down there? Everything looks like it's healing up good. I'm going to go ahead and take my gloves off. I'm going to go ahead and check your Holman sign. And this just shows me if you're having any DVT. And so what I'm going to do is I'm going to lift your knee, and I'm going to put your foot back. You let me know if there's any pain. No pain? Good. And I'm going to check clonus. That's a negative. All right. Good. And if she were to have a C-section, then I would check the incision and make sure that that's clean and no discharge or anything. And I would check her IV, make sure that the IV is pain and there's no redness or anything around the IV. And I would check to make sure that the dressing is clean and dry around the incision. And that is the postpartum assessment.